A Navy commander gave a secret signal to a rookie ER nurse, and the hospital CEO froze like he'd just seen a ghost. That's not the kind of thing that happens in ordinary life. But then again, neither is realizing the room meant to save a man might be the very place someone wants him dead. Picture a midnight emergency room in San Diego. Fluorescent lights. Rain on the ambulance doors. Doctors moving fast, machines screaming, everyone focused on blood and broken bones, while one quiet nurse notices the only detail that really matters. A look, a gesture, a warning. This story is different because it isn't just about trauma or medicine or military secrets. It's about what happens when the only person paying attention is the one nobody respects. Watch to the end and tell me where you're watching from. Watch to the end and tell me where you are watching from. The words would have sounded almost casual to anyone listening on a phone speaker in the dark, but inside St. Catherine's Medical Center nothing felt casual tonight. The emergency department in San Diego was the kind of place that never really slept. At midnight it only changed shape. The daytime noise of visitors and administrators gave way to a different rhythm. Metal wheels rattled over tile. Monitors pulsed with steady electronic warnings. Intercoms cracked to life and went silent again. Somewhere down the hall, a child cried in short, exhausted bursts. In another room, an old man coughed with the rough persistence of someone who had spent years around salt air and cigarettes. Beneath the bleach, the plastic, and the sterile chill of fluorescent light, the place carried the faint human smell of sweat, adrenaline, and fear. Claire Bennett moved through it with a tray of saline flushes tucked against her hip, her steps quick but never hurried. She had learned that speed and panic were not the same thing. Panic burned energy. Precision saved lives. She stopped at a supply cabinet, checked the count on trauma dressings, restocked a half-empty bin, and closed the door with the back of her hand. A voice called for a chart. Another called for a line kit. A resident rushed past her so fast his shoulder brushed her arm without apology. Claire did not look up. She was still new to the ER rotation, and the department had already decided what that meant. To the senior nurses, she was competent enough for errands and quiet enough to be ignored. To the residents, she was the one who appeared when they needed something and disappeared the moment they did not. To Dr. Owen Burke, the attending trauma surgeon on duty tonight, she was another fresh face who had not yet learned how quickly a room could turn against anyone who hesitated. That was fine with Claire. Invisible people heard more. They noticed the slips in routine, the missed details, the truths that louder people stepped over on their way to feel important. At the far end of the station, a veteran nurse named Janice was correcting a younger tech in the clipped voice of someone who mistook being tired for being superior. A patient in bed 9 was asking for pain medication for the third time in 20 minutes. Someone in pediatrics had sent down a request for extra blankets. The monitor above Trauma 2 was dark. For the moment, the room cleaned and ready, its stainless steel tray tables empty and cold under the lights. For half a second, Claire let her gaze rest there. An empty trauma bay always looked calm right before it became a battlefield. She turned back to her cart and picked up a chart left open on the counter. A woman in her late 60s with chest pressure, probable anxiety, maybe more than anxiety. Claire scanned the notes, committed the medication list to memory, and felt the familiar tug of old training at the edge of her thoughts. Assess the room. Find the threat. Stabilize the living. Keep moving. That voice had never really left her. She had just finished documenting a blood pressure reading when Dr. Burke came around the corner in a storm of movement and irritation. Where is the central line kit? Claire lifted the pack from the cart in her hand. Right here. He took it without breaking stride, barely glancing at her face. Then don't stand there holding it. The words were sharp enough to make the unit clerk look down at her keyboard. Janice hid a look behind a chart. Claire said nothing. She had heard worse in places where people were bleeding onto dirt instead of polished hospital floors. Burke was a good surgeon. Everyone said so. Fast hands, sharp instincts, ruthless when the clock turned against him. But he had the kind of authority that made assumptions early and held on to them harder than he should. Tonight, he had already decided Claire was too quiet to be useful and too new to matter. He moved on before the silence between them could become awkward. Claire set the empty cart aside and checked the wall clock. 12:17. Her shift had another 6 hours to go. A man in a business suit paced outside a curtained room with his tie loosened and his phone pressed to his ear, speaking in the low, furious voice of someone trying not to sound frightened in public. An exhausted mother dozed upright in a chair with her hand still wrapped around her son's ankle so he would not wake alone. A respiratory therapist laughed at something near the nursing station, the sound short and bright and gone in an instant. The ordinary details of other people's worst nights. That was what most emergency rooms were made of. Then the radio at the desk crackled. Inbound trauma, 2 minutes. Highway rollover off Interstate 5. 1 deceased at scene. 1 critical en route. Possible chest trauma, altered vitals, adult male. Everything around Claire shifted. Not visually at first. The furniture did not move. The walls did not shake. But the atmosphere tightened all at once the way the air changes before a storm hits the water. Janice straightened. A resident closed a chart and grabbed gloves. Burke reappeared as if pulled forward by a wire. Trauma 2, he said, move. Claire was already moving. She pushed through the doors into the bay, checked suction, verified oxygen, pulled fresh tubing laid out. Syringes clamped. A line opened sterile packs and lined instruments, and the order hands usually reached for them under pressure. Around her, the team fell into practiced positions, each person stepping into a role they had performed often enough to make it look automatic. But automatic was never the same as easy. Claire knew that better than most. The overhead lights felt brighter in a trauma room, the air colder, every sound sharper. The clock on the wall suddenly mattered. ETA 60 seconds, someone called. Claire snapped on gloves. Then she heard the ambulance doors outside. The sound crashed through the bay like metal striking bone. The paramedics came in hard, wet tire tracks shining behind them, voices raised over the hiss of oxygen and the squeal of the stretcher wheels. Male 43, the lead paramedic called. High-speed rollover. Passenger side impact. Severe blunt force trauma. Driver was non-responsive on arrival and pronounced at scene. Patient was conscious on extraction. Blood pressure trending down. Possible internal bleed. Chest bruising. Shoulder trauma. No confirmed loss of airway. The team swarmed the gurney, and the man on it changed the room. Commander Mason Trent did not look like the sort of patient hospitals were built for. Not because he was bigger than the bed, though he nearly was. Not because of the torn tactical undershirt plastered dark with blood across one side, or the bruising spreading across his ribs like ink blooming beneath skin. It was something else, something in the way he held himself even while hurt. He was injured. That much was obvious. He was also still in command of himself. Claire stepped in to hang the line and caught sight of the identification clipped to the transport sheet. One of the residents saw it a second later, and the shift in the room was immediate. Mason Trent, United States Navy, Special Warfare Command. Nobody said the words out loud, but everyone felt them. High profile. Sensitive, important. Burke's tone sharpened. The resident at the foot of the bed stood straighter. Janice suddenly paid closer attention to every move around the gurney. High-profile patients did that. They changed the stakes before anyone admitted there were stakes to change. Claire focused on Mason's face. Pain had carved deep lines around his eyes and mouth, but confusion had not. Most crash victims came in broken open by momentum. Their gaze wandered. Their words tangled. Their bodies fought the room because their minds had not yet caught up to what had happened. Mason did none of that. His breathing was controlled, even shallow. His eyes were open. Not wide with panic, narrowed, calculating. He was scanning. Not the lights, not the ceiling, not the hanging bags or the monitor cables. People. Hands, faces, distances, exits. The habit was so deeply ingrained it survived blood loss. "Commander Trent, can you hear me?" Burke said. Mason gave the smallest nod. "Do you know where you are?" His lips parted. "Hospital." "Good. Do you know what happened?" There was the briefest pause. Claire watched it happen. Not the answer, but the decision before the answer. Crash. The paramedic beside the bed picked up the thread immediately. Single vehicle rollover on the northbound curve near La Jolla Village Drive. Vehicle left the lane, hit barrier, rolled once. Claire listened without speaking, her gloved hands moving on instinct as she secured the line and checked the flow. The story was simple. Too simple. Her eyes dropped to the bruising along Mason's shoulder and forearm. Something about the marks did not fit. They were not impossible for a crash. That was what made them dangerous. But they looked wrong for passive impact. There was resistance in them, tension, angles suggesting he had twisted, braced, fought movement instead of simply absorbing it. She looked again at the forearm. Small abrasions near the wrist, muscle strain in the flexor line, as if his hand had been engaged just before impact. "Pressure is softening," the resident said. "Start fluids," Burke replied. "Prepare imaging. We need chest-abdomen head." Claire adjusted the line and leaned just enough to check the commander's pupil response. Mason's eyes flicked to her. For a second, she saw not a patient, but an operator measuring variables in hostile territory. Her voice came out quietly, almost to herself, a habit she had never fully broken. "Watch for delayed thoracic changes." The words slipped into the air and nearly vanished under the noise, but Mason heard them. Claire knew it because something changed in his face. Not relief. Recognition. His gaze sharpened. Before she could think through what had just happened, Burke brushed past her shoulder. "Monitor the IV, Bennett. We'll handle the rest." She stepped back, not because she agreed. Because arguing in the first minute of a trauma resuscitation did not save anyone. She had learned years ago that the room had to be read before it could be influenced. Pressure found the weakest personality and broke it first. So she let the room keep believing what it wanted, that she was new, that she was quiet, that she was there to follow instructions and stay out of the way. Across the hall, a security camera angled down from the corner of the ceiling, a black, glossy eye no one ever noticed, until they were asked later what it had seen. Several floors above, Thomas Kesler stood in his office with one hand resting on the edge of a desk, too expensive for honest medicine. His office walls were glass, his tie still neat. His expression arranged into the calm concern of an executive who liked to appear involved in high-stakes cases without ever touching blood himself. A bank of security monitors glowed across one wall. He had been watching the incoming trauma feed for the same reason men like him watched anything important. Reputation, exposure, risk. A Navy commander bleeding in your hospital could become tomorrow morning's headline. And headlines had a way of becoming donors asking questions. Kesler's gaze shifted from the wider trauma bay view to the close angle over the patient's left side. Then he saw Claire, saw Mason's eyes fix on her, saw the tiny exchange nobody else in the room had yet understood, saw her hand answer in a way that should not have meant anything to a civilian nurse. His face lost color so quickly it looked unnatural beneath the office lights. He stepped closer to the monitor. In the ER below the trauma bay kept moving. Burke cut away more of Mason's shirt. A nurse applied leads. Another resident called out oxygen saturation. Someone asked again for the crash details, and the paramedic repeated them with the polished consistency of someone who had already said the story enough times for it to sound factual even if pieces were missing. Single vehicle. Wet road, lost control. Claire looked from Mason to the second stretcher rolling in behind the first. The deceased driver. The body had been zipped into a black transport pouch and laid on a narrow rolling frame just inside the room because the corridor outside was too crowded for immediate transfer. It was not uncommon in a busy night shift. The dead waited where space allowed. The label clipped to the bag read Evan Rourke. Claire barely let her eyes rest there before Janice appeared beside her. Bennett. Claire turned. Get me another flush and clear the cabinet side. You're blocking access. Claire handed over what Janice needed and moved the tray an inch to the left, though it had not been blocking anything. Janice lowered her voice. When Burke says monitor the IV, he means monitor the IV. Claire met her eyes for the first time. I heard him. Janice seemed almost disappointed by the calm in that answer. She took the flush and moved off. Claire turned back to the bed. Mason was still scanning. He should not have been able to do that with this level of pain. Not this precisely. Not unless it was built deeper than the body's desire to surrender. Once, a long time ago, Claire had worked beside men who scanned every room that way. They mapped danger before their boots had fully crossed a threshold. They counted windows, noted shadows, listened for what did not belong. She had watched them work in places where there were no polished floors and no administrators watching from safe rooms above. She had promised herself that life was over. Then a wounded man on a hospital gurney looked at her with the exact same awareness, and the years between now and then thinned to almost nothing. Burke pressed fingers near Mason's abdomen. Any tenderness here? Mason gave the smallest wince. Here, another nod. Possible internal bleed, Burke said to no one in particular, as if saying it enough would make the answer settle into place. Claire studied the monitor. Elevated pulse. Dropping pressure, yes, but not dropping in the messy way she expected from hidden internal hemorrhage. The decline had shape, rhythm. Not proof, not yet. Just friction against the official story. Commander Trent Burke said, "Were you wearing a seatbelt?" Mason's answer came slow, yes. Did the driver say anything before the crash? A pause, longer this time. Number. That answer too felt chosen. Claire stepped closer again, under the cover of adjusting the line. Mason's fingers twitched once against the rail. Then again. 2 taps on his wrist. A pause. 1 slow drag downward with his thumb. Every muscle in Claire's body locked. Friendly compromised. There were hand signals learned in training, and then there were truths carved by necessity into nerves and memory. This was the second kind. A silent warning meant for moments when language could get you killed. Claire had not seen that signal used in years. She answered before fear finished catching up, rotating the IV tubing at a slight angle and pressing the clamp with her index finger twice. The response was tiny, invisible to anyone not looking for it. Mason let out the faintest breath. Confirmation. The room closed in around Claire without changing at all. Burke was still issuing orders. Janice was still charting. A resident was still talking about transport imaging. The dead driver still waited in the black bag by the wall. The same monitors beeped with the same indifferent rhythm, but now Claire knew the patient on the bed believed at least one enemy was close enough to matter. And if he was right, then everyone here was already standing inside the wrong story. She forced herself to breathe and kept her face blank. In the office above, Kesler reached for the arm of his chair and gripped it hard enough for the knuckles to pale. He had the look of a man who had built entire systems around being underestimated and had just realized he had underestimated the wrong person. He glanced toward the office door, then back at the monitor. His pulse showed once in the hollow of his throat. Down below, Claire moved to the supply side of the room, pretending to straighten instruments. She could feel Mason's warning settling into her like ice water. Inside the threat. That was what the signal meant in this context. Not an abstract danger, not a fear from the crash scene. Present danger, immediate, embedded. She let her eyes travel around the room without appearing to do so. Burke focused and impatient. Janice rigid and territorial. 2 residents, 1 green one trying too hard to look seasoned. A respiratory therapist whose hands shook slightly when she adjusted the mask tubing. A paramedic finishing handoff notes. A unit clerk at the doorway. Any of them could have been nothing. Any of them could have been enough. Claire hated the uncertainty more than fear. Fear had edges. Uncertainty filled a room and left no clean place to stand. Bennett Burke said sharply, "I need that pressure bag." She handed it over immediately. "Thank you," he said automatically, already looking away. It was the first polite word anyone had given her all night, and it came only because his hands were too busy to carry his ego. Claire glanced once toward the second stretcher. The driver had been wheeled just far enough into the bay for the edge of the black pouch to catch on the frame. The zipper pull reflected the light in a small silver glint. Beneath the fabric, the outline of the shoulders lay wrong, somehow one side slightly elevated. That could mean nothing. Or a lot. Time of scene extraction, Burke asked the paramedic. 23:41. Loss of consciousness. Not while we had him. Burke nodded and turned to the resident. Let's keep him stable enough for CT. If the abdomen lights up, we move fast. The resident nodded too quickly. Claire kept hearing the same words in her head. Friendly, compromised. It had not been panic in Mason's eyes. It had been assessment. Trust given under pressure to the one person in the room he had reason to believe might understand. Why her? The question rose and vanished almost immediately because some part of her already knew the answer. The phrase she had murmured earlier. Watch for delayed thoracic changes. The words themselves were ordinary enough in medical language, but her cadence had not been civilian. Neither had the economy of it. Men like Mason recognized the shape of old training even after years apart. Especially after years apart. Claire swallowed and reached for a fresh syringe she did not yet need. The driver's stretcher stood very still near the wall. Then, someone rushed through the doorway carrying a portable monitor stand, brushing the frame hard enough to make the second stretcher jolt. The black pouch shifted. Not much. Just enough for the top edge near the collar to fold back a fraction. Claire saw pale skin, then cloth, then the line of the neck, and something in the geometry of it made her stop. Not because it was grotesque, because it looked clean. Too clean for a man who had supposedly died in a violent rollover. A strange quiet opened beneath the surface of everything. Not in the room, in her. Burke was speaking. Janice answered. The resident called out another number. Mason's blood pressure continued its careful decline. Claire took one step toward the body bag, then another, slow enough that no one would read intent in it. She was still holding a syringe she did not need. The zipper pull gleamed again. The edge of the fabric near the collar had slipped just enough to show the base of the throat. Claire lowered her hand toward the black pouch, and the night inside St. Catherine's shifted 1 inch closer to the truth. Claire caught the edge of the black pouch between two gloved fingers and lifted it no more than necessary, as if she were only checking the identification tag clipped near the zipper. The room behind her stayed loud and bright and oblivious. A resident called for updated pressure. Metal touched metal on the instrument tray. Dr. Burke asked for another line to be primed. No one looked her way. Beneath the folded edge of the pouch, the dead man's skin was pale. Beneath the trauma room lights, the collar of his shirt darkened with rain and road grit. Claire let her eyes move once quick and clinical, the way she had been trained to see before anyone else knew there was something to notice. The wound sat just below the collarbone. Small, round, clean, not torn by shattered glass, not ragged from metal, not the bruised violence of impact. A bullet entry. For a heartbeat, she felt nothing at all, as if her body had decided to suspend reaction until her mind caught up. Then her pulse hit hard against the inside of her throat. She lowered the fabric, carefully setting the secret back where she had found it. But there was no undoing what she had seen. The driver had been shot before the crash. Not after. Not during the rescue, before. The room did not change. That was the worst part. Machines kept beeping. Nurses kept moving. The paramedic was still answering questions. Dr. Burke's hands were still on Commander Mason Trent's chest, pressing, assessing, calling for imaging. On the surface, nothing had altered at all. But Claire now understood the simple story had collapsed. A rollover on wet pavement was one thing. A driver with a bullet hole beneath his collarbone was something else entirely. A staged crash, an execution disguised as an accident, or something even uglier. She stepped back from the stretcher and slid the empty syringe onto the tray so her hands would look occupied. She could feel the dead driver's body at the edge of the room now, not as weight, but as meaning. Evan Rourke was no longer just a casualty waiting for transport to the morgue. He was evidence, a witness who would never speak. Across the bay, Mason lay half-stripped of his ruined shirt, bruising, deepening under fluorescent light. His breathing stayed shallow, his focus unnervingly intact. He was not watching the ceiling. He was not lost in pain. He was still studying the room like a man who knew every second of inattention could cost someone their life. Claire moved back to the bedside and adjusted the IV flow with motions so routine no one would think to question them. Her mind was racing ahead of her hands now, testing possibilities, cutting down bad assumptions before they could take root. If the driver had been shot first, then he had not simply lost control. If he had not lost control, then the crash itself had purpose. If the crash had purpose, then someone wanted Mason alive long enough to reach this hospital. That thought turned colder the longer she held it. Not dead on the roadside, not dead in the wreck, here. Inside a building where medicine could be mistaken for mercy until the wrong syringe touched the wrong line. Pressure's dropping again, the resident said. How far, Burke asked. 90/60 and sliding. Keep fluids going. I want imaging ready now. Claire leaned in, pretending to check the catheter tubing while she watched the numbers. The decline was there, but it was still wearing the mask of explainable trauma. That alone would have been enough to fool most rooms on most nights. But the room had already lied once. She knew that now. Once a case crossed that line, every routine answer became suspect. She waited until Burke stepped half a pace away to ask for a scan order, then spoke in a voice pitched low enough not to interrupt the room. The driver didn't die from the collision. Burke barely turned his head. Excuse me? Claire kept her tone steady. There's a penetrating wound below the left clavicle. It looks ballistic. For the first time since Mason arrived, Burke looked fully at her. Not because he believed her, because he could not decide whether to be irritated or amused. We have field report on the deceased, he said. High-speed impact, fatal trauma. Claire held his gaze. The wound is clean. Too clean. Something in his expression closed. Then let pathology sort it out, he said. We are not working the body bag. We are saving the living patient in front of us. He turned back to the bed before she could answer. That was not surprise in his voice. It was refusal, the kind that came from a man too deep in momentum to tolerate a reality he had not personally found. Claire stepped back. The dismissal did not sting. Not really. She had expected resistance. In places where hierarchy mattered more than truth, evidence often had to knock twice before anyone opened the door. Still, a hard frustration settled under her ribs. Every minute this stayed framed as a simple trauma case was a minute lost to whoever had arranged the crash. Janice came alongside her to swap tubing and shot her a quick, narrow look. Problem. Claire kept her eyes on the monitor. No. Janice's mouth tightened, perhaps disappointed that there was no visible mistake to correct. At the bed, Burke pressed Mason's abdomen again, then moved to the shoulder, reading bruising, making calculations, building a story out of what his hands could confirm. Claire understood the instinct. Trauma surgeons lived by pattern recognition. So did field medics. The danger was not that Burke lacked skill. The danger was that he had already chosen the pattern. Claire glanced toward the body bag again. Evan Rourke. A name clipped to black plastic. A bullet wound under the collar. A man who had been in the driver's seat when the SUV went into the barrier. The line between victim and participant was suddenly harder to draw. Mason's head shifted slightly on the pillow. His eyelids lowered, then lifted again. He had been listening, she realized. Not to everything, not enough for details, but enough to know she had tried to say something and been cut off. Claire stepped in to flush the line. His fingers moved against the rail. Not the earlier signal this time, smaller, weaker, almost nothing. She bent closer, letting her hair fall enough to hide the movement of her mouth. "Can you hear me?" Mason's lips parted. The sound that came out was nearly lost under the beeping monitor. Driver. Claire leaned closer. Not enemy. The words were breath, not voice, but they landed with surprising force. Claire frowned. Her eyes flicked toward the black pouch by the wall and back to him. Not enemy. That did not erase the crash. It did not erase the shot. But it altered the shape of the man in the bag. Not assassin, then. Not the architect. Something else. Someone trapped inside a role he may not have chosen. Mason's fingers dragged once more along the rail, slower now, the movement straining against weakness. Inside. His throat worked. Claire moved, as if checking the line again. Threat. She straightened too quickly and caught herself forcing calm back into her shoulders before anyone could read alarm in the motion. Inside threat. He did not mean the dead driver. He meant the hospital, the room, the people standing within arm's reach. Her awareness sharpened so suddenly the bay seemed to tilt into focus around her. The hiss of oxygen. The squeak of Janice's shoes. The resident's left hand trembling ever so slightly as he reached for tape. The paramedic at the doorway finishing report. The respiratory therapist checking the mask seal. Burke asking for a scan time. The unit clerk glancing at the clock. All of it ordinary. All of it potentially meaningless. And yet one person in this room had likely been trusted with medication. One person may have known which route the ambulance was taking. One person might have heard the name Mason Trent and understood exactly how dangerous it was to let him live. Several floors above Thomas Kesler had not moved away from the security monitors. His office was silent except for the low hum of climate control and the almost imperceptible static hiss from a bank of live camera feeds. He stood close enough to the screens that the light washed his face in ghostly blue. On one monitor, the trauma bay looked like any hospital trauma bay. Controlled urgency. White coats, gloves, shouted numbers. A high-profile military patient under bright lights. On another monitor, Claire's body language told a very different story. Kesler watched her speak to Burke and be brushed aside. He watched her bend near Mason's shoulder. Watched the almost invisible shift in her posture after she listened at the bedside. He had no audio, but he did not need it. He knew what recognition looked like. He knew what it meant when someone quiet stopped moving like everyone else in the room. His gaze slid toward the image of the second stretcher at the wall. The body. He had already accounted for the body. Accounted for the report, the confusion, the timing, the transfer, the fact that trauma rooms were loud enough to hide small deviations inside larger emergencies. He had trusted volume. He had trusted the habits of institutions. Most nights that was enough. Tonight the wrong nurse was on shift. Kesler reached for the desk phone and pressed a private extension. A woman answered on the second ring. Pharmacy. He kept his voice even. This is Thomas Kesler. I need confirmation that trauma medications for the military intake are being routed through standard chain. A pause. Yes, sir, they are. Good, he said. I want them handled personally. By who? Kesler kept his eyes on the monitor. By someone careful. He ended the call before she could ask another question. For a moment, he stayed very still, the receiver still in his hand. Then he set it down and adjusted his cuff, a small pointless movement that betrayed more than panic would have. Control mattered to men like him. Routine mattered. Once routine frayed, they started touching things, straightening things, searching for order in fabric and glass and polished wood because they could no longer find it in events. Downstairs, Claire moved toward the supply tray and set down the used syringe she had been holding too long. She needed a cleaner look at the room. Not with panic. Panic narrowed vision. She needed breadth. She tracked every person in the bay again. Janice was annoyed, not dangerous. The paramedic was already backing away from the active treatment zone. The respiratory therapist's nervousness looked authentic. The resident closest to Burke was too focused on impressing him to notice anything else. The second resident had gone pale at the sight of blood, but was still performing tasks correctly. The unit clerk at the doorway looked bored, which in a trauma room was a kind of innocence all its own. Any of them could still be a mask. Claire knew that. Yet the threat Mason warned about did not feel like immediate physical violence from someone in scrubs. It felt more deliberate than that. Embedded, procedural, something capable of passing through a hospital without raising its pulse. Medication, orders, access. She hated how quickly her mind landed there because once it did, every routine step became a possible weapon. Burke said, "Get me another flush." She handed it over. His eyes stayed on the line. "And stop hovering. I'm monitoring the patient," she said. Burke's mouth hardened. "Then monitor quietly." Claire stepped back again. The old instinct to push was there. So was the older instinct to survive the room. She chose survival for the moment. There were kinds of resistance that looked like obedience. She had practiced them long before she wore hospital scrubs. The body bag stood only a few feet away. She could still feel the presence of the wound beneath the fabric. A nurse from transport appeared at the door with a clipboard. "Morgue intake ready for the deceased when you are." "Give us a minute," Janice called back. The transport nurse nodded and waited in the hall. Claire used the interruption to move toward the black pouch again. This time, she crouched as though checking the tag for transfer paperwork. Her eyes ran over the exterior quickly. No obvious tear in the bag. Rainwater had dried in irregular streaks. The clipped label listed the scene location, extraction time, and tentative cause as motor vehicle fatality. Nothing about penetrating trauma. Nothing about firearm injury. Either no one had seen the wound at scene, which was possible in darkness and rain and urgency, or someone had seen it and decided not to say. Claire touched the edge of the collar through the opening again. Not enough to expose, just enough to confirm what her eyes already knew. The flesh around the wound had not split the way impact abrasions split. It was precise, almost neat. One point of violence hidden inside another. She lowered the fabric. "Can I help you with something, Bennett?" Janice's voice cut through the room from behind her. Claire rose slowly, checking the transfer tag. Janice glanced at the bag, then at Claire's face. "That body can wait. Commander Trent cannot." Claire let the correction pass. Understood. Janice remained there a second longer than necessary, measuring her, deciding whether this was inexperience or defiance. Then she went back to the bed. Claire followed at once. Better to yield while keeping her line of sight. Mason's blood pressure held for the moment, though not by much. Burke ordered another scan request and asked whether radiology was clear. A resident answered too fast. The room was moving on tracks it trusted. Claire knew better than to believe tracks could not be redirected. At the head of the bed, Mason's eyes opened again. He found her almost immediately. That alone told her how hard he was fighting to stay conscious. Not for pain control, not for comfort, for information, for threat management. Claire moved in close enough to wipe blood from the line of his jaw where a cut near his temple had reopened. It gave her an excuse to lean down. The driver was shot. She murmured so softly the words barely existed. Pain flickered in Mason's face, followed by something stranger. Not surprise. Confirmation, maybe. Regret. His lips moved. Rourke. He swallowed with difficulty. Family. Claire absorbed the word without reacting. Family. Not enough to understand. Enough to reframe. A coercion story. A leverage story. Someone forced into proximity. Someone turned. Mason's eyes shifted toward the ceiling camera for the barest fraction of a second before returning to her. Claire felt a line of cold move through her. He was not warning her in the abstract. He was mapping the room for her the way he would map a kill zone for a teammate. Inside threat. Look up. She did not follow his gaze directly. Not yet. Instead, she adjusted the tape on the IV, then took one step back and let her eyes travel naturally around the upper corners of the bay. Security camera. Black dome mounted high where everyone forgot it until after the fact. Of course, every trauma bay in St. Catharines had one for liability and review. Every executive suite had access to the feed. Claire felt the implication settle hard and clear. If someone higher up was involved, they could be watching the room in real time, watching who noticed, watching who spoke, watching whether the commander remained a problem. For the first time since the ambulance doors opened, Claire felt truly seen. Not by Burke, not by Janice, not by Mason. By whoever was behind the glass of power in this building, studying the same room from somewhere safer. Her eyes returned to Mason's face. He saw that she understood. That was enough. He let them close again, conserving what little strength he had. Burke snapped off one pair of gloves and pulled on another. "We need him moving to CT in 3 minutes. Where are we on transport?" "Ready when you are," one of the residents said. Claire's mind moved quickly. If the commander left the room, the threat moved with him. Hallways, elevators, scan suites, medication checkpoints. More blind angles. More access points. Yet staying here under the eye of the camera was no safer. Hospitals were built on movement. Once the machinery of care started rolling, it could carry harm just as efficiently as help. She checked the line again and felt Mason's skin cool under her fingers. Not just blood loss, stress response, maybe something more. The pattern in his vitals still bothered her, though it had not declared itself enough to challenge openly. Not yet. Burke glanced at her. "You look like you want to say something." The room quieted just enough for the sentence to matter. Claire answered carefully. "I think the scene story is wrong." Burke's expression cooled. "Based on—" She held his gaze. "The driver's wound. The patient's awareness. Injury patterns that do not read clean rollover." A resident shifted uncomfortably. Janice looked from Burke to Claire as if waiting for the hit. Burke folded one gloved hand against the bed rail. "You are making a very large leap from limited information." Claire kept her voice low. "Maybe. But if I'm right, then this room is not handling a routine trauma." Burke took one step toward her, close enough for authority to become physical. "We handle evidence when law enforcement asks. We handle medicine now. Do you understand me?" Claire did understand. Perfectly. He was not only rejecting her assessment, he was protecting the order that let him function. Without order, the room became something he could not command with training alone. "Yes," she said. He studied her a second longer, perhaps dissatisfied by the lack of visible submission in that answer. Then he turned away. Good. Prep for movement. The room resumed breathing, but the residents had heard. Janice had heard. The transport nurse at the door had likely heard enough. A crack had opened. Even if no one wanted to look through it yet, the crack was there. Several floors above Kesler saw the same exchange on the monitor and felt the shape of the night changing too fast. He moved to the sideboard near his office windows and poured water he did not want into a crystal glass he did not need. His hand stayed steady. Only someone watching very closely would have noticed the water rose too near the rim. On the monitor, Claire returned to the bedside. Too calm, he thought. That was what made her dangerous. Not suspicion, not experience. Calm. Panic could be managed. Calm kept thinking. He set the glass down untouched and called another extension. Security. "Yes, sir. Keep hall access around Trauma 2 limited. Use discretion. Is there an issue? High-profile patient. Media sensitivity." "Yes, sir." He hung up. That should have been enough to make him feel in control again. It did not. Something in Mason's continued survival had begun to feel personal. The commander was supposed to have arrived. Broken, slipped into complications, and never fully climbed out. That had been the elegance of the arrangement. A wreck on a wet highway. A body at the wheel. Confusion in the dark. Hospitals did the rest on their own when people were tired and stories arrived pre-packaged. But the room below had acquired a variable no one had budgeted for. A nurse with military eyes. Down in Trauma 2. Claire checked the portable monitor battery as the team prepared for movement. She did not need to check it. The battery light was green, but bending over equipment gave her cover to think. She needed proof that someone else could not wave away. The bullet wound was one piece, but it belonged to a dead man already sliding toward the paperwork and refrigeration. Mason's warning was another, but it was trapped in whispers. She needed something living, something active, something that touched the commander now. Her gaze moved over the medication tray, the line ports, the syringes waiting in their wrappers, the labels, the chart. Burke's hands, Janice's hands, the resident's hands. The clock. Routine, routine, routine. And somewhere inside routine a blade. A tech rolled in a portable imaging board and nearly clipped the corner of the tray. Burke swore under his breath. Janice caught the edge before anything spilled. The momentary burst of motion drew every eye except Claire's. She was looking at Mason. His mouth had tightened. Not from the near collision, from listening. From some internal countdown the room had not yet recognized. Claire leaned in one last time before transport, checking the pulse ox on his finger. "Can you stay with me?" she asked quietly. Mason's eyes opened halfway. "Long enough," he whispered. Not reassuring, not dramatic, just a soldier's measurement of what remained. Claire gave the pulse ox clip a slight adjustment and stepped back. "Transport now," Burke said. The order went out. The bed brakes released with a metallic click. The wheels began to turn. And as the gurney started toward the trauma bay doors, Claire looked once more at the black body pouch waiting by the wall, at the rain streaks drying on its surface, at the name Evan Rourke clipped to the zipper like a label on a secret. Then she turned and followed Mason into the corridor, carrying the truth of that wound with her like a concealed weapon. Then she turned and followed Mason into the corridor, carrying the truth of that wound with her like a concealed weapon. The hallway outside Trauma 2 felt colder than the bay. It always did. Inside the room, urgency had a center. A bed, a body, a monitor that all eyes could gather around. In the corridor, urgency stretched thin and dangerous. Wheels rattled over seams in the floor. Doors opened without warning. Voices came at angles. A hospital in motion created blind spots no battlefield ever needed to invent. Claire walked on Mason's left side with one hand near the portable monitor pole and the other close enough to catch the IV tubing if it snagged. Burke led from the front, already speaking to radiology through a resident who was trying too hard not to sound rushed. Janice trailed the bed with an emergency medication pouch tucked under one arm. The transport tech steered carefully around a housekeeping cart abandoned too close to the wall. Every passing face looked ordinary. An orderly with linen, a family member clutching coffee in both hands, a security guard near the elevator bank, a pharmacist in blue scrubs crossing the corridor with a sealed tray. Ordinary could hide anything. Mason's eyes remained half open as the gurney rolled under the strip lighting. Claire saw them move once to the security camera at the hallway corner, once to the elevator doors, once to the stairwell sign. Even hurt, he mapped every line of approach. The monitor gave a sharper tone. Claire looked down immediately. Pressure had slipped again. Not collapsed, slipped. The rhythm bothered her more with each minute. Internal bleeding could turn ugly fast, but it usually did not descend this neatly. This looked guided, like a hand on the back of his physiology pressing him downward in measured intervals. "Hold up," Burke said. The bed stopped 10 feet short of the elevator. The resident nearest the footrail glanced at the screen and swore under his breath. Pressure 88/56. "How long since the last drop?" Burke asked. "Less than 3 minutes." Burke looked at Mason's face, then at the line, then at the corridor around them as if deciding whether to commit to movement or retreat. Claire knew the answer before he spoke. "Back to Trauma 2, Burke said. "Now." The team pivoted cleanly, the gurney turning hard enough for one wheel to squeak against the floor. Claire kept the monitor steady and moved with them, the fluorescent lights sliding across Mason's bruised skin in bands of white. The corridor around them swallowed the brief disruption and went right on being a hospital. By the time they rolled back through the trauma bay doors, the room felt different, not chaotic, tight, as if some invisible thread had been pulled through the air and cinched every person in it 1 degree closer to strain. Burke snapped out fresh orders before the brakes locked. "Increase fluids. Get me a fresh blood gas. Prep another medication dose. We stabilize here before we move. Janice was already opening the medication pouch. The resident at the head of the bed adjusted oxygen flow. Another nurse stepped in from the adjoining station with additional tubing and a tray of sealed vials pulled from pharmacy. Claire took her position near Mason's line and watched everything. Not just the patient. Everything. The tray arrived on stainless steel, a neat arrangement of clear glass labels, capped syringes, alcohol pads, routine arranged to look harmless. The nurse who carried it was one Claire recognized from Central Medication Services, a woman named Leah with a tired face and the quick movements of someone whose whole shift had been spent walking between requests. Pharmacy sent the stat meds, Leah said. Burke held out a hand without looking. Set them there. Leah obeyed and stepped back at once. Claire's eyes went to the tray because Mason's warning had changed the meaning of ordinary objects. A syringe was no longer just a syringe. A vial was no longer just a vial. In a hospital, harm did not need to come in wearing a mask. It only needed the right label. Mason's pulse climbed another notch. The resident called it out. Claire reached for the medication vial nearest her under the simple excuse of verifying the dose before Janice drew it up. It was a habit no one ever argued with in a trauma bay. Double-checking made rooms feel safer even when safety was already compromised. She rotated the glass beneath the overhead light. The rubber stopper showed a tiny dull mark near the center, not the clean, untouched crown of a fresh vial. A puncture, already accessed. For a moment, the entire room seemed to recede from her. Sound thinned. The fluorescent glare sharpened the tiny indentation until it looked as obvious as a bullet hole in a white wall. Claire lifted the vial a little higher. There it was. One previous needle entry, small enough to miss. Impossible to explain. She did not raise her voice. Stop. Burke turned sharply, annoyance already present before comprehension arrived. What is it? Claire held out the vial. This seal has been punctured. Janice frowned. That's not possible. Claire kept her eyes on the stopper. It is if it happened. Burke snatched the vial and leaned under the light. His face did not change at first. Then the irritation in it hardened into something colder. The resident beside him leaned in too, saw the mark, and blinked. That should be sealed from pharmacy, he said. Leah took an involuntary half-step backward. I picked it up from the secured bin myself. Burke looked at her. Was it tampered with before it got here? I do not know, she said too quickly. I did not check every stopper. I just grabbed the stat tray. Claire watched the room absorb the fact. No, not as suspicion, as matter. A medication intended for a critical patient had arrived already punctured. Routine had just broken in full view of everyone. Get rid of it, Burke said. Now. I want a replacement pulled in front of me. Leah nodded and was out the door before the sentence finished. Janice looked from the tray to Claire, and for the first time all night there was no condescension in her expression. Only unease. The resident at the monitor said, "Could it have been used for a dose check?" No, Burke said, not like this. His voice had changed too. He was no longer dismissing possibility on instinct. He was standing in a room that had just revealed itself capable of betrayal, and his mind was catching up at surgical speed. Claire set the discarded vial aside on a separate tray and marked it with a blank specimen label so no one could claim later that it had simply been confused with waste. She did it without asking. No one stopped her. On the bed, Mason exhaled through his teeth, pain tightening the tendons in his neck. He had heard enough. Maybe not every word, but enough to know something in the room had validated his warning. Claire stepped in and adjusted the line. His eyes opened a fraction. She did not need to speak. He saw the tray, saw the vial set apart. Understood. The muscles around his mouth loosened just enough to look like relief dragged through exhaustion. Burke was already moving again. Draw labs, full coag panel, repeat blood gas, get me a clean med pole and call pharmacy directly. Not the desk, the pharmacist in charge. The resident hurried to the phone. Janice took the sample tubes and moved fast, now none of her earlier territorial stiffness left in the motion. When institutions realize something inside them is rotten, hierarchy often gives way to appetite. Everyone suddenly wants facts more than status. Several floors above, Thomas Kesler watched the same small rupture unfold on silent screens. The rejected vial sat apart from the tray like a piece of evidence that had chosen the wrong time to become visible. He saw Burke inspect it, saw Leah retreat, saw Claire mark it off from the others with maddening calm. His jaw tightened. The elegance of the plan had always relied on blend, one layer protecting the next. Crash confusion buying clinical misdirection. Clinical misdirection buying physiological collapse. If the room ever slowed down enough to examine the mechanics, the disguise began to fail. Kesler picked up his phone again. No answer this time from pharmacy. He let the line ring twice more, then set it down without ending the call properly, and walked to the monitor wall instead. His reflection hovered faintly over the trauma feed, a ghost superimposed on the room below. For the first time that night, he looked less like an executive and more like a man staring at a flood he had once called manageable. In Trauma 2, the replacement medication arrived from pharmacy less than a minute later. This time, carried by the supervising pharmacist herself, an older woman named Dr. Ellen Wade, whose expression suggested she had been pulled from a problem and did not appreciate surprises. "I opened the cabinet personally," Wade said as she set down a fresh sealed vial. "This one came from a locked drawer. No prior access." Burke checked the stopper himself. "Clean." He nodded once. "Thank you." Wade's eyes moved to the rejected vial on the side tray. "Who flagged that?" Burke looked at Claire. For one suspended beat, every eye in the room followed his. Claire said nothing. Wade picked up the discarded vial without touching the stopper and held it under the light. "That did not leave my department like this." Her voice was flat now. Professional anger. The kind more dangerous than shouting. "Can you prove chain on it?" Burke asked. Wade looked at the label, then at Leah, who had returned and stood frozen near the door. "I can prove what was issued. I cannot yet prove who touched it after." "That answer may need to become better very quickly," Burke said. Wade met his gaze, then slipped the vial into a specimen bag and sealed it. "It will." She left with the bag, and the room returned to the immediate problem of keeping Mason Trent alive. Burke nodded at Janice. "Administer the replacement." Janice drew the dose from the clean vial. Claire watched her hands the whole time. Smooth. Controlled. No tremor, no deviation. The medication went in. For a minute, the numbers held. Then Mason's blood pressure began to drift downward again. The resident leaned toward the screen. "That is not enough response." "Push fluids," Burke said. "They are already running." The pulse climbed higher. Oxygen wavered. Burke's eyes flashed to the monitor, then to Mason's bruised abdomen, then back. The logic of the case was still trying to force itself into a trauma mold, but the mold was cracking faster now. Claire stared at the screen. There it was again. The pattern, not random compensation. Not the messy instability of a body losing volume faster than anyone could replace it. This was too shaped, too incremental. A slide that behaved like design. A sound from years ago touched the back of her mind. Rotor blades. Dust. The high-clipped breathing of a wounded operator on a folding cot under floodlights. Her own hands slick with blood and saline while another medic shouted clotting values over the engine wash. She saw it so suddenly she almost lost the present for a second. A field clinic on the border. Midnight heat. A man everybody thought was dying from hemorrhage. Treatment that should have worked and did not. One old corpsman, with half a cigarette tucked behind his ear, muttering that blood did not lie like this unless someone had taught it how. The operator had been dosed before the ambush. A chemical anticoagulant. Not enough to kill immediately. Enough to make every wound become worse than it should. Enough to make standard trauma treatment chase the wrong enemy, while the real one moved invisibly through the bloodstream. Claire looked at Mason's lines, at the bruising, at the repeated shallow drops that returned even after intervention. The memory snapped fully into place. The feel of it, the cadence, the slow, controlled collapse masquerading as complications. Her stomach turned cold. "This is not just trauma shock," she said. No one answered at first because no one wanted to hear another impossible thing in the same 10 minutes. Claire stepped closer to the monitor. His pressure is not falling like a hidden bleed. It is cycling. Look at the spacing. Look at the rebound failure after the clean dose. Burke was already looking, which meant he had noticed enough to be bothered, not enough to surrender. "That could still be unstable trauma," he said. "It could," Claire answered. "But it reads wrong." Janice glanced up from the line. Wrong how? Claire felt every pair of eyes in the room draw toward her. She had avoided this for years. Not this exact moment, but its shape. The point where staying silent cost more than speaking, and speaking exposed parts of herself she had kept sealed under routine, under paperwork, under the manageable anonymity of a civilian badge. She kept her voice level. "It looks like a clotting disruption introduced before admission." The resident at the head of the bed frowned. "You are saying poison." Claire chose the cleaner word. "A chemical anticoagulant or something acting like one." "That is not in his report," the resident said. "It would not be," Claire replied. Burke's gaze sharpened. "Explain." Claire pointed toward the monitor, not like a lecturer, but like someone tracing a line she had walked before. "If he were just bleeding internally, we would expect a more chaotic decline with response points that match volume replacement and pressure support. He is not doing that. He drifts, partially answers, then slips again in a measured pattern. It is like the body cannot hold any gain because clot formation is being undermined faster than we are accounting for." The younger resident looked uncertain. "Could severe trauma alone mimic that?" "Sometimes," Claire said. "But not with this rhythm. Not after replacement dose from a clean vial. Not with what happened to the driver." Burke heard the connection in that sentence. His eyes narrowed. "You are tying the ballistic wound to a chemical agent. I am tying both to intent." The room went still enough for the monitor tones to sound suddenly louder. Burke stepped to the bedside and looked at Mason as if the answer might be written on the bruises. "Commander Trent," he said louder now. "Were you injected with anything before the crash?" Mason's eyelids fluttered. His lips moved, but no sound came. Claire leaned close, catching the whisper against the ambient noise. "Needle," he breathed. "Neck." She straightened and repeated it. "He says there was a needle at the neck." Burke's hand went instantly to the side of Mason's throat. He parted the skin near the bruising, searching. For a moment there was nothing obvious. Then Claire saw him stop. There, a tiny puncture hidden near the line where the collar had rubbed and the bruising had spread. Not large enough to call attention to itself in a room already saturated with damage. Large enough to matter. The resident nearest to Burke cursed softly. Janice looked like she had forgotten to breathe. Burke touched the site once more, then pulled back. When he looked at Claire again, the resistance was still there. But it had become disciplined resistance, the kind a smart man has when he knows the old answer is dying in his hands. "You have seen this before," he said. Claire met his gaze. "Yes. Where?" She did not answer that. Mason's pressure dipped again. The screen gave another strained warning tone. Time made the decision for everyone. Burke turned sharply to the team. "All right, we pivot. Full coag focus. Stop treating this like routine blunt trauma until proven otherwise. Get me reversal support. Get the lab moving faster. I want toxicology involved if they are breathing tonight." The younger resident blinked. "What reversal support? We do not even know the agent. We know enough to stop pretending the current plan is working." Burke snapped. Claire was already moving. Warm him more aggressively. Recheck the line sites. Minimize anything that worsens dilution. Get blood products ready, but do not flood blindly. If the clotting pathway is being sabotaged, volume without control just feeds the leak. The words came out of her before she could make them smaller. Everyone in the room heard, not a rookie nurse, but someone used to being obeyed when clocks ran red. Janice looked at her once startled, then did exactly what Claire said. The residents moved. Burke hesitated only a fraction before he joined that movement rather than opposing it. That was the moment Claire understood something important about him. For all his ego, he cared more about saving the patient than about being the sole owner of the right answer. Men like that could still be dangerous under pressure, but they were not useless. Mason's head turned slightly toward Claire, his breath thin but steadier in its cadence now that action had finally aligned with threat. Claire checked the neck puncture again under brighter light. The skin around it showed faint irritation, recent enough, precise enough, intentional. She felt the old field rhythm settle over her fully now, the one she had spent years teaching herself to bury. A narrowing that was not panic. A sharpening. The world reduced to sequence: hands, lines, numbers, breath. She heard Burke behind her, Bennett. She looked up. His expression was stripped of irritation now. Talk me through what you want next. Not a challenge. An invitation made urgent by necessity. Claire did not waste time reacting to the shift. Protect pressure without drowning him. Get clotting support ready. Expedite the lab. Watch for continued rebound failure. If the pattern changes after the next intervention, we are closer. If not, we reassess. And keep every medication documented from this moment forward. Burke nodded once. Do it. The room became something else then. Not civilian, not military, not exactly either. A temporary organism built around one goal. Save the man before the hidden mechanism finishes what the crash began. Janice hung warming fluid. The resident pushed for expedited coag results with a voice that had stopped trying to impress anyone. Another nurse sealed the remaining medication tray and labeled it for review. Burke examined the neck puncture again and dictated the finding into the chart so it could not be erased by later confusion. Claire adjusted the pressure support, then leaned close to Mason's ear. "Stay with me," she said. His answer was barely sound at all. Trying, she believed him. In the executive office upstairs, Kesler watched the room reorganize itself around Claire's instructions and knew the line had broken for good. He could not hear her, but he could read Burke's face well enough. The surgeon had stopped fighting her. Worse, he was listening. Kesler felt something hot and corrosive move through his chest. Rage would have been simpler. Fear would have been cleaner. This was something more humiliating. The realization that a plan built over months could be undone in minutes by one person with memory and nerve. He turned away from the screen at last and opened the bottom drawer of his desk. A folder lay there, thick and bound with a discreet black clip. Vendor contracts. Research authorizations. Names that should never have existed in the same chain of paper. He stared at it, then shut the drawer again without touching the contents. Not yet. Back in Trauma 2, the lab called with preliminary clotting numbers. The resident read them and went pale. These values are off the chart. Burke held out a hand for the printout. Claire saw his eyes move once across the page and harden. "That is not crash trauma alone," he said quietly. No one argued. The proof was not complete, but it no longer needed to be. The room had crossed the threshold from suspicion into response. Burke looked at Claire. "You were right." She did not answer. Not because she wanted the moment withheld. Because affirmation had no practical use while Mason was still balancing on the edge. "Administer," she said, already resetting the line. Janice did. Burke watched the monitor. The resident watched the blood pressure. Claire watched everything at once. For a few seconds, nothing changed. Then Mason's pulse stopped climbing. It did not drop. It simply stopped that upward relentless crawl and held. A moment later, the pressure rose by a narrow but unmistakable increment. The resident leaned in closer to make sure he was not imagining it. "He is coming back." The room said nothing. No one in trauma celebrates early. They had all seen too many brief recoveries vanish on the next breath. But then the numbers held, then improved. Only slightly. Only enough. Enough to break the downward script. Janice released a breath that sounded almost like anger. The younger resident sat back on his heels. Burke stared at the screen, then at Mason, then at Claire with an expression she had not seen on him before and had no interest in naming. Mason's eyelids opened. Not all the way, enough. He found Claire again. This time there was no warning in his eyes, only recognition. The kind shared by people who had both seen the same trap and cut the same wire before it finished the job. Claire checked his line, His oxygen, his neck, puncture, all with the same measured motions she had used all night. On the outside, nothing about her changed. But the room had changed around her. She could feel it. People now stepped half a beat sooner when she moved. No one told her to be quiet. No one told her to monitor only the IV. Burke pulled off one glove and flexed his hand as if trying to release tension he had forgotten he was carrying. "Where did you learn that?" Claire kept her eyes on the chart. Somewhere, protocol had less time to catch up. It was not an answer. Burke knew it. He looked like he might press. Before he could, the hallway outside filled with a sudden pattern of footsteps that did not belong to ordinary hospital flow. Deliberate. Coordinated. Not rushed, but not casual either. The sort of movement that came from people entering a scene already aware they were late to something serious. The sound reached the doorway just as Mason's pressure climbed one more careful notch and held. The sound reached the doorway just as Mason's pressure climbed one more careful notch and held. The trauma bay doors opened with a controlled swing, and two people stepped inside who did not belong to the ordinary choreography of medicine. They were not hospital staff, not police in uniform, not administrators hurrying to ask if the press had called. They moved with the kind of restraint that altered a room without demanding attention, and because of that, everyone noticed them at once. The woman came in first, dark blazer over plain clothes, hair pulled back, eyes that missed nothing and gave away even less. Behind her was a taller man with a weathered face, a federal badge already visible at his belt, as if he had no interest in playing polite games about why he was here. The resident at the monitor looked up. Janice stopped mid-motion with a syringe wrapper in her hand. Dr. Burke straightened from the bedside, the calculation already beginning in his face. The woman spoke first. "Agent Rachel Sloan, Federal Protective Service Task Force." She angled her identification just enough for the room to verify it. "This is Agent Derek Vaughn." No one interrupted her. Sloan's gaze moved to Mason on the bed, then to the printout in Burke's hand, then to the sealed medication tray on the side table, then finally to Claire. "We are here about the highway incident," she said. "We were informed there may be evidence this was not a routine vehicle crash." She did not raise her voice. She did not need to. Every sentence from the last 10 minutes suddenly sounded different in the room. The punctured vial, the wound in the body bag, the neck injection site. None of it belonged only to hospital procedure anymore. It belonged to something larger, something legal, something that would not accept charting shortcuts and dismissive answers. Burke shifted first. "Commander Trent is unstable but improving," Good Vaughn said, "because we need to know who identified a possible toxic agent." Burke looked at Claire. It lasted only a second, but in that second, the room changed around her again. The staff, who had ignored her. The surgeon, who had cut her off. Janice, who had been waiting all night for her to overstep. Every line of attention moved and settled on the same person. Claire kept her hands on the IV line as if she had not noticed. Vaughn studied her with the stillness of a man who had spent years reading witness hesitation, military bearing, false certainty, and fear. Claire nodded once. "What did you see?" Sloan asked. Claire did not look at the agents immediately. She checked Mason's line first, then the monitor, then the neck puncture site. Only when she was sure he was holding did she turn. "Tampered medication," she said. A prior puncture in a sealed vial, irregular response pattern inconsistent with routine, blunt trauma. A puncture mark at the neck consistent with pre-admission injection. And the driver in the deceased pouch has a ballistic wound below the clavicle. The younger resident actually inhaled at that, as if hearing all the pieces lined up by one voice made the situation more real than watching them arrive separately. Sloane's expression did not change, but something in her eyes sharpened. "You saw the body yourself?" "Yes." "Did anyone else confirm it?" "Not yet." Vaughn's jaw moved once, not surprise, more like the recognition of a timeline getting uglier by the second. "Chemical anticoagulant isn't standard language for a civilian nurse to reach for that fast," he said. It was not an accusation. It was not curiosity either. It was a probe. Claire knew that tone. She had heard versions of it in debrief rooms at checkpoints and aid tents after firefights where men asked quiet questions because quiet questions often pulled out the truth better than shouting. She answered carefully. "I have seen a similar profile before," where Vaughn asked. Claire said nothing. The silence held for one beat too long. Then Mason opened his eyes. He was pale beneath the lights, his skin damp, his breathing still shallow, but the clarity in him had returned enough to cut through the room with startling force. Because she was our medic, no one moved. It was the kind of sentence that did not merely add information. It reordered hierarchy. It reached backward through every dismissive exchange of the night and exposed them all as built on the wrong assumptions. Burke's gaze went to Claire. Janice's face emptied into stunned stillness. Even Agent Sloan looked at Claire differently now, not with suspicion alone but with recalibration. Mason swallowed and continued each word, costing him effort. "Attached to our unit, combat medic." Vaughn glanced from Mason to Claire and back again. "You are confirming she served operationally with you." Mason's eyes held his. "She kept operators alive in places your people only read about after the fact." The resident nearest the monitor looked down as if embarrassed to have been standing in the room when Claire was told to monitor only the IV. Claire did not lift her chin. She did not claim the reveal. She did not let herself be pulled into the center of the scene. Her hands kept working. She adjusted the flow rate, checked the oxygen, and made a note on the chart because that was how discipline survived detention. "You kept doing the job." Sloan stepped closer. "Ms. Bennett, why are you working here under civilian licensure without any indication of prior field assignment?" Claire met her eyes. "Because this is where I work." Vaughn almost smiled at the non-answer, but there was no humor in it. He recognized it for what it was. A boundary. Mason let out a thin breath that might once have been a laugh. She always did answer like that when she didn't want the whole room inside her business. Burke looked between them. "You knew each other, and neither of you said anything." Claire turned her attention back to Mason's line. He came in bleeding. Introductions were not the priority. That answer carried more weight than if she had snapped. Burke heard it. The room heard it. Sloan glanced at Vaughn, then pulled a small notebook from inside her jacket. "Start at the vehicle," she said. "From the last confirmed safe point." Mason closed his eyes briefly, gathering what strength he could. Claire saw the effort in his throat before the first word came. "Picked me up near the marina." Driver was Evan Rourke. Contract transport. Knew him by face not well. He was quiet, too quiet. Vaughn stepped closer to hear. "When did you first know something was wrong?" Mason opened his eyes again. He kept checking mirrors without traffic. Hands tight on the wheel. "Took one call he thought I didn't hear." "Could you identify the voice?" Sloan asked. "No." Male, short. Said only one thing clear enough to keep. He paused, then forced it out. "Do not miss this one." The room absorbed that in silence. Claire felt the dead driver's body by the wall, even though it was no longer in her line of sight. Evan Rourke now heavy with another layer of meaning. Sloan wrote quickly. "Then what?" Mason's gaze unfocused for a second, not with confusion, but with pain. Claire adjusted the oxygen mask slightly and waited. "Needle," he said. "From behind. Neck. Thought it was Rourke at first. Maybe not." Black sedan came close at the light before the highway entrance. Passenger side, window crack. Then pain. Small, fast. His jaw tightened. Rourke looked terrified after that. Vaughn and Sloan exchanged a look that lasted no more than a blink. Enough to confirm they were slotting his account into a structure they already partly understood. Claire heard the shape of it immediately. A rolling insertion. A roadside delivery method. No need to stop the vehicle. No need to stage a full abduction. Just a brief exposure, a puncture, and time as weapon. Sloan asked. After the injection, Mason's eyes shifted once toward Claire before coming back. Rourke started shaking. "Told me I should have stayed away. Said they had his family." He swallowed again. Then there was gunfire. Every person in the room froze in place, even if only internally. From where Vaughn asked. Left side, Mason whispered, not at me, at him. Claire closed her eyes for the briefest instant. That was it then. Evan Rourke had not simply been a coerced driver. He had been a disposable witness. Used to deliver the commander into the right conditions, then shot before the final impact so the entire scene could be read as chaos. A man forced into betrayal and murdered before he could become testimony. Sloane looked at Claire. And you found the entry wound. Claire nodded. Below the clavicle, clean. No crash tearing. Burke spoke for the first time in several seconds. Why would anyone go to that much trouble instead of finishing it at roadside? It was Vaughn who answered. Because roadside leaves ballistics, public witnesses, body positioning, traffic cams, and police first response. Hospitals bury a lot of ugly things under routine when everyone is tired, and the chart already says trauma. The words settled over the room like a second layer of cold. Claire thought of the punctured vial. Routine is camouflage. Exactly. Sloane turned back to Mason. Commander Trent, you were coming to meet us, is that correct? Mason's eyes opened more fully. Yes. Regarding what? For the first time all night, Mason hesitated in a way that had nothing to do with pain. Claire recognized it at once. Not fear. Classification instinct. Years of knowing what information did and did not belong in unsecured rooms. Sloane saw it too. We can move this later if necessary. Right now I need enough to lock the building down correctly. Mason's gaze drifted upward for a moment toward the ceiling camera, then back to Sloane. Procurement chain, he said at last. Restricted compounds moving through shell vendors. Medical research fronts. Non-military buyers on paper. Different reality underneath. Burke frowned. Compounds for what? Mason's answer came low and flat. Field testing. Coercive use. Black access distribution. The younger resident looked lost. Janice looked sick. Claire felt a hard quiet settle in her chest. The pieces were fitting now, and the picture they formed was uglier than a simple assassination contract. This was not only about one commander. It was about what he knew and who profited from keeping that knowledge buried. Sloane asked, and this hospital. Mason let his eyes shift again just once toward the upper corner of the room where the security camera sat behind smoked glass. That was answer enough. Vaughn followed the look. Then, slowly, very slowly, he turned his head toward the same camera. Across the hospital in his office, Thomas Kesler felt the movement like a hand closing around his throat. He had been standing too close to the monitor wall again, the blue glow flattening his face, when Vaughn looked directly into the camera lens. It should not have meant anything. The agent could not see him, could not know precisely where he stood. And yet the effect was immediate and physical. Kesler stepped back from the screen. The room around him suddenly looked staged. The glass walls, the framed commendations, the donor photographs, the polished wood. Every object chosen over years to project authority control philanthropy. Now they looked like props around a man who had run out of exits. He reached for his phone again, then stopped with his hand hovering over it. No calls. Every call now was evidence. Down in Trauma 2. Vaughn spoke without looking away from the camera. Who has live executive access to this feed? Burke blinked. Administration, security, risk management. Names Vaughn said. Burke's attention flicked to the doorway where the unit clerk had gone pale. Hospital CEO. Security director. Some risk personnel. Possibly chief operations. Sloane was already taking out her phone. Lock the access logs now. No deletions. No archive flush. She stepped into the hallway and spoke with the clipped authority of someone who had been waiting all year for a room to finally catch up to the threat she already suspected. Claire remained at Mason's side. His breathing had improved, but the effort still showed in every rise of his chest. She adjusted the blanket higher over his shoulder and checked the dressing near the neck puncture again. Vaughn lowered his voice. Commander, if Kesler's involved, We need the cleanest version of why. Mason's eyes came back to him. Because I had names, routes, internal sign-offs, enough to pull vendor records apart, enough to link a hospital board office to a chain of shell contracts. Burke stared at him. Our CEO. Mason said nothing. He did not need to. The answer was already in the agent's stillness. Claire glanced toward the hall. More footsteps now. Not one pair. Several. The shift in hallway sound told her federal response had begun to spread through the building. Radios. Security shoes. The hushed acceleration of a hospital realizing its walls had become part of a crime scene. Janice placed a fresh dressing near the line site and finally spoke, her voice stripped of its usual sharpness. "You're saying somebody in this hospital tried to kill him after the crash?" "No," Vaughn said. "We are saying the crash and the hospital were likely part of the same effort." Janice's hand stopped on the bed rail. The younger resident looked toward the sealed medication tray as if it might suddenly explain itself. Claire could feel the room's center of gravity shifting yet again. This was no longer a trauma team temporarily handling outside interference. The institution itself had become suspect. Every badge swipe, every locked cabinet, every executive override, every camera feed. It all meant something new now. Sloan returned from the hall. Building access is restricted. Security is being isolated from its own control board until federal review. Pharmacy logs are frozen. Executive floor elevators have been flagged. Burke stared at her. "You can do that this fast?" She slid her phone away. "When we have reason to believe a protected witness was targeted inside a medical facility, yes." That phrase landed on Claire harder than she expected. Protected witness. Mason was not merely a patient caught in bad luck. He was a man already moving toward testimony. That explained the layered precision. The road, the injection, the staged crash, the clinical follow-through. Too many systems had been bent around one outcome for it to be anything else. Mason's eyes closed again, then opened with effort. "Rourke," he said. Vaughn leaned closer. "What about him? Not enemy." Claire heard the distinction more clearly now than she had at the bedside earlier. Not innocent. Not enemy. A man shoved into a corridor with no good direction to run. Sloan nodded once as if confirming something painful but useful. "We pulled a preliminary background before we came in. Evan Rourke had no criminal profile that matched professional hostile action. Debt history. Sudden account movement. Wife and son off-grid since yesterday afternoon." The room absorbed that, too. Claire looked down at Mason. He was forced. Mason's eyes found hers. Family. There it was again. The same word from earlier now, with enough context to become tragedy. Vaughn's tone lowered. Vehicle forensic team already ruled out mechanical sabotage. No brake line cut, no steering failure. If Rourke turned that SUV into the barrier, he did it himself. Burke frowned. Then why shoot him before impact? "Because a coerced man can change his mind," Sloan said. "A dead man cannot." Claire felt something heavy and human move through her chest then. Not fear. Not outrage exactly. Grief sharpened into disgust. Evan Rourke had likely believed there was still some version of survival available to him if he obeyed. Deliver the passenger. Make the turn. Keep his family alive. Instead, he had been erased inside the same motion, used twice, once as leverage, once as cover. Mason's voice came back thin, but steady enough to command attention. He was trying to talk. He swallowed. Right before the shot, kept saying he was sorry. No one in the room answered. There was nothing useful to say to a dead apology. Claire adjusted the blanket again, more for herself than for Mason. Small motions kept the mind from dwelling too long in anger. Burke glanced at her. "You knew the signs faster than any of us." It was not quite an apology. Not yet. More like an admission made while the need for pride was still being amputated. Claire kept her eyes on the monitor. "I knew the pattern." Burke studied her for a second. "You were military. Yes. Why leave? The question escaped him before he could stop it. Claire heard that. He had not meant to ask out of gossip. He had meant it the way tired surgeons sometimes ask questions after seeing someone do something they did not know was possible. Not, who are you? More like, what did the world do to build you this way? Claire's hand paused on the chart, then resumed. Because I was done, she said. Burke let the answer stand. Vaughn, to his credit, did not push either. He was already listening to voices on a small earpiece, his posture tightening as updates reached him. Executive floor is not clear, he said to Sloan. Sloan's eyes hardened, meaning, CEO office occupied 10 seconds ago, not occupied now. The silence that followed was dense and immediate. Claire looked toward the hall. Sloan moved first. Seal, stairwell access, pull camera backtrack from his office. I want every elevator freeze-framed. Vaughn was already at the doorway, one hand to his earpiece. Copy. No one moves him past level 3 without visual confirmation. He vanished into the corridor. Sloan stayed, but only barely. She had turned into pure decision now, her mind moving through hallways and logs and badge traces with the same urgency Claire used on the monitor. Before leaving, she looked once more at Claire. Do not leave this bay unless you are moving with him under clearance. Claire nodded. Sloan's gaze shifted to Burke. Doctor, from this moment, every person touching that patient is documented by name and time. Burke did not bristle. Understood. Then, Sloan was gone too, swallowed by the growing federal movement in the hall. The room exhaled only after she disappeared. Janice adjusted her stance near the medication tray as if she no longer fully trusted her own hands. The younger resident stared at the door another second before remembering he was still in the middle of a critical case. Burke scrubbed one hand over his face and looked older than he had 30 minutes earlier. Mason's pressure held, not high, not safe enough for anyone to relax, but holding. Claire checked the line sights once more. The old rhythm in her had not faded. It had only gone quieter now that the room was finally aligned with reality. She could feel eyes on her still, but differently. Not dismissive. Not even curious in the old way. More like the staff around her had realized she contained an entire history they had not been qualified to evaluate. Janice was the one who broke the silence. I told you to keep your eyes on the IV. Claire looked up. Janice gave a humorless breath that might have been the beginning of shame. Seems like you did. It was not elegant. It was enough. Claire let the faintest expression touch the corner of her mouth, then disappear. We all did eventually. Burke glanced at her, hearing the grace in that sentence, and perhaps knowing he had not earned it. He moved to the side of the bed and checked Mason's pupils again. You bought him time, he said quietly, not taking his eyes off the patient. Claire understood at once that he meant more than the last medication sequence. He meant the moment she stopped the punctured vial. The moment she said this is not just trauma shock. The moment she forced the room to see past its own habits. She answered in the only register that felt survivable. He was already trying to stay alive. Mason's eyes opened a sliver at that. Helps, he murmured. Even half-broken, he had perfect timing. The younger resident let out an involuntary laugh, brief and strained and grateful for any release from the pressure. It faded quickly, but it changed the air enough for everyone to breathe one full breath. Then the hall noise surged again. A cluster of steps. Radio chatter. A security badge buzzer cycling off and on. Claire looked towards the doorway. Not fear. Readiness. In the office upstairs, Thomas Kesler no longer looked like a man deciding what to do. He looked like a man living inside the last seconds before his decisions reached him. He had left the monitor wall. The office lights were off now except for the city glow beyond the glass and the silent wash of camera feeds behind him. A leather folder sat open on his desk beside an access card, 2 phones and a pen he had unconsciously uncapped and never used. He could hear movement in the corridor outside his office now. Not ordinary administrative traffic. Measured, searching. He opened one drawer, then another. Nothing useful. The folder on the desk contained enough to ruin him. enough to ruin men far beyond him. Names, shell vendors, research allocations, masked under legitimate procurement signatures tucked into approval chains so carefully they had once seemed impossible to untangle. He placed his hand on the folder, did not lift it. Somewhere below, a nurse he had never noticed during hiring had dismantled months of concealment simply by paying attention. That was the part his mind kept circling with poisonous disbelief. Not the commander surviving. Not the agents arriving. The nurse. The one variable no model had rated as decisive. He slid the folder back into the drawer just as a hard knock hit the office door. Not loud, not polite. Final. Kesler closed the drawer and straightened instinctively old habits, making one last attempt at authority. When he looked up, his own reflection in the dark glass behind the desk looked like a stranger waiting to be replaced. Down in Trauma 2. Claire adjusted Mason's blanket one more time as the first controlled lock sequence engaged somewhere down the hall. She heard it as much as felt it. Doors changing state. Access shifting. The building beginning to choose sides whether it wanted to or not. The hospital was still bright, still sterile, still full of patients who knew nothing about shell vendors, coerced drivers, or poisoned lines. But St. Catherine's was no longer merely a place where a wounded commander had been taken for treatment. It had become a live crime scene with a pulse on one bed, a dead witness in a body pouch, and a ceiling camera that had watched too much. Claire kept one hand near Mason's line, one eye on the monitor, and listened as the sounds of federal control spread room by room through the floor. Outside the bay, the first security doors were already starting to lock. Outside the bay, the first security doors were already starting to lock. The sound carried through the corridor in clean electronic clicks, one after another controlled access points changing status across the floor. It did not sound dramatic. Hospitals rarely did. Their most serious decisions were often announced by small noises, a latch engaging a code spoken into a radio, a phone line going dead. Inside Trauma 2, everyone heard it. Burke looked towards the hallway. Janice did the same. The younger resident actually stopped writing for a second pen, hovering above the chart as if the sound itself had weight. Claire kept her eyes on Mason. His pressure was holding in a range that no longer looked like surrender. Not safe yet. Not close. But holding. His skin had lost some of its gray cast under the fluorescent lights, and while the pain still gripped the tendons in his neck and jaw, the fierce, restless edge from earlier had eased. He no longer looked like a man dying on someone else's schedule. He looked like a man who had clawed his way out of the first trap and was now waiting to see where the next one had been hidden. Burke checked the monitor again and let out a careful breath. I want him ready for ICU transfer as soon as Federal clears movement. Janice nodded. I'll prep the packet. Claire adjusted the line sight at Mason's wrist, checked the tape, then laid 2 fingers lightly against his pulse as if the machines were not enough. Old habit. Machines lied less than people, but hands could still catch things numbers missed. The beat beneath her fingertips was not strong, but it was more honest than it had been 20 minutes ago. Mason opened his eyes. He looked at her first. Not the surgeon, not the chart, not the door. Her. You stayed, he said. His voice was rough with damage and dryness, but it carried. Claire did not look up from the line. You noticed. One corner of his mouth moved the smallest amount. Still answer like that. She changed the saline flush and made sure the tubing hung clean. Still talked too much for a patient. The younger resident glanced between them, hearing familiarity that went deeper than any chart note. Janice pretended not to hear at all. Burke, to his credit, simply kept working. Footsteps approached the bay door, quick but measured. Agent Sloan entered first, Vaughn half a pace behind her. There was movement in the hall behind them now. More agents, more uniforms, a current of contained force spreading through the unit without turning it into chaos. Sloane's face had changed. Not relaxed, sharpened, purpose distilled. Kesler has been contained on the executive floor, she said. No one in the room spoke at once. The words landed without fanfare, which somehow made them more powerful. No chase through stairwells, no shouting, no dramatic confession, just a sentence, the kind that closes around a person and does not let go. Vaughn stepped farther in. His office is sealed. Digital access is frozen. Security has been split from administrative control. We have records preservation in motion. Burke looked from one agent to the other. Contained means arrested. Contained means he is no longer making decisions, Sloane said. The paperwork is catching up. There was a hard efficiency in that answer. She did not care what word made the room feel better. She cared about the next 15 minutes. Claire glanced once toward the hall. Through the narrow window in the bay door, she could see shadows moving past under the flat white light. Agents. Security personnel being redirected. An administrator in a charcoal suit standing uselessly against the wall with a phone pressed to his chest, as if contact with it might still matter. Mason's breathing steadied another notch. Vaughn moved to the foot of the bed and lowered his voice. "Commander, we found partial records in Kesler's office. Procurement authorizations, shell billing access logs. Enough to support immediate hold measures. Not enough yet to name the full chain." Mason closed his eyes briefly, taking that in. "Others?" he asked. "We are working outward," Sloane said. "Research partnerships, vendor routes, special access accounts." He was not doing this alone. The room stayed silent. That truth did not surprise Claire. Networks never rested on one man. They rested on layers, on people who handled only their piece and called that distance innocence. One person signed, another routed, another failed to ask the right question because the answer would have required courage. Burke folded his arms, then unfolded them immediately, unused to being idle in the center of so much action. "If this involved our pharmacy chain, then more than one department is compromised," possibly Sloane said. "Or possibly one compromised access point was enough. We do not guess until we have the logs." She turned to Claire then. "Walk me through the medication timeline exactly as you saw it." Claire gave her the sequence, each detail clean and ordered. The first stat tray arriving through regular channels. The punctured stopper visible under direct light. The replacement vial brought by Dr. Wade from a locked drawer. The separation of the discarded vial from active medication. The neck puncture consistent with pre-admission injection. The rebound failure pattern that shifted after the treatment change. Sloane wrote quickly, her pen never pausing. Vaughn listened without interrupting, though his attention split once toward a voice on his earpiece. "Copy," he murmured. "Hold that corridor and keep him seated." Claire knew without being told that the him was Kesler. For a moment an image rose in her mind, uninvited. The CEO in his office, still trying to wear his composure like a pressed suit, while the walls around him turned from symbols of status into evidence containers. She had seen men like that before. Men who believed systems were softer than bullets and therefore more reliable. Men who hid violence inside procedure because it kept their own hands clean. She did not dwell on him. Mason was still here, still on the bed. Still the only task that mattered inside this room. Sloane finished the last note and looked up. The driver's body is already under federal hold. Preliminary forensic photography confirms a ballistic entry at the upper chest with no corresponding trauma pattern to suggest crash origin. We will know more once the full exam starts. Janice stared at the counter. "So the poor man never had a chance," Vaughn answered with blunt honesty. "He may have thought he did. That was worse somehow." Claire looked at Mason. His eyes were open again, fixed on the ceiling for a moment before returning to the room. She wondered what exactly he was seeing behind the light, the road, the mirror. The black sedan edging close at the last red light before the highway opened up. Men under stress often remembered in fragments first. A hand on the wheel, a ring on a finger, a phrase, the smell of vinyl and rain. "Rourke's family?" Mason asked. Sloane's expression softened by a degree so small it could almost be missed. "Our field teams located the wife and son alive 40 minutes ago. They were being held at a rental property in Chula Vista. They are in protective custody now." Mason's eyes closed. Not in relief exactly. Relief belonged to safer rooms than this. But the line of tension across his forehead eased as if one more burden had loosened its grip. Claire felt something inside her unclench too. Rourke was dead. Nothing would change that. But his last choices no longer ended only in a body bag. His family had survived the trap built around him. That mattered. Burke nodded once almost to himself. Good. The younger resident looked up from the chart face, pale with the dawning awareness that he would be talking about this night for the rest of his career, and never sound less shaken when he did. What happens to the rest of the hospital? Sloane capped her pen. Right now, the rest of the hospital keeps doing its job. We isolate what was touched, we preserve what matters, and we do not create panic for people whose children still need stitches and whose parents still need oxygen. By sunrise, we will know more. Burke gave her a look that almost resembled respect. That may be the most medicine anyone has spoken in this room in an hour. Sloane did not smile, but Vaughn did very slightly. Claire adjusted the blanket over Mason's shoulder again. The movement brought her hand near the bruised line of his upper arm, and memory flashed through her so quickly it was almost physical. Another shoulder under another light dust instead of bleach in the air, a different century of noise. She pushed it back down. This was not the time to let memory widen. Mason watched her face. You left before I could say goodbye. The sentence came out quietly enough that only the people nearest the bed heard it. Claire smoothed the blanket without looking at him. That was the point. Burke busied himself with the chart. Janice found a reason to check the medication tray. Both of them had enough grace to understand when a conversation no longer belonged to the room. Mason's gaze stayed on Claire. You vanished. People do. Not like you. She finally looked at him then. There was no accusation in his face. Only tired truth weathered by pain and years. He remembered her as someone who had once moved toward noise, not away from it. You were supposed to live through that deployment, Claire said. That felt like enough. His mouth twitched again, the shadow of old humor. Setting the bar low. You always did aim high enough for both of us. A brief silence settled, not uncomfortable, simply full. The kind that belonged to people sharing history without naming it. Vaughn shifted at the doorway and touched his earpiece once more. We have escort clearance for ICU in 2 minutes. Dedicated route. Federal control on both ends. Burke straightened. Good, we move now while he's holding. The room immediately became work again. Janice finalized the transfer packet. The resident printed the latest vitals. Burke confirmed the line security and dressing integrity with quicker, humbler hands than he had started the night with. Claire checked every connection herself before the bed rolled. Oxygen, fluids, support meds, monitoring leads, blanket secure, neck sight visible enough for reassessment, protected enough not to aggravate. Sloane stepped aside to clear space. Once he is upstairs, 2 agents stay outside the room. No administrative access without our approval. Burke nodded, understood. The brakes released. The gurney eased forward. Claire took her place at Mason's side again, just as she had in the corridor before, one hand near the line, one eye on the monitor. The hall outside Trauma 2 looked the same at first glance. White tile, recessed lights, directional signs. But the sameness was false now. Federal agents stood at intersections. A security guard who had earlier looked casual near the elevator bank now stood disarmed of confidence beside a wall, watched by a man in a plain suit with a radio. A pair of administrators spoke in whispers near the nurses' station and stopped the instant the bed emerged. No one touched the route. No one crossed ahead of them. The hospital's everyday flow bent around the moving gurney and then closed behind it, absorbing the anomaly so patients in other rooms could go on believing they were only inside a hospital. At the elevator, Vaughn checked the doors himself before they opened. The car was empty. He stepped in, scanned once, then signaled the team forward. As the bed rolled into the elevator, Mason's eyes lifted to the small mirrored panel near the ceiling. Claire saw him register the reflection of the people around him. Burke, Janice herself, Vaughn in the doorway. For the first time that night, no one in that reflection looked like a hidden threat. The elevator doors shut. The ride upward lasted only seconds. Long enough for the hum of the machinery to fill the small space. Long enough for Claire to realize that once Mason reached ICU and the line of crisis softened, the old questions would return. About her, about why she had left, about what people became after years of learning medicine in places where the law came late, if at all. She had no intention of answering more than necessary. The doors opened onto intensive care. The unit was dimmer than the ER. The light gentler, the sounds more disciplined. A nurse at the desk looked up ready with whatever greeting she had prepared for a standard transfer, then saw the agents flanking the hallway and forgot the rest of the sentence. Burke took over with clipped precision. 51-year-old male, blunt trauma, probable chemically complicated clotting disruption, currently stabilized after field-informed protocol adjustment, tampered medication event under federal review, protected movement only. The ICU nurse blinked once, then nodded as professionals do when the facts are impossible. But the work is still the work. Room 12 is ready. They rolled Mason in. The room was narrow, private, quiet. One large window faced the dark city where San Diego glowed in scattered ribbons beyond the glass. Dawn was still far off, but the black sky had begun the faintest shift at its edge, less absolute than it had been an hour ago. The transfer from gurney to ICU bed went smoothly. Claire steadied the lines while Burke guided the shoulders. Janice secured the blanket. The ICU nurse connected wall oxygen and monitoring. Numbers reappeared on a new screen, blinking their indifferent truths into a new space. When it was done, Burke stepped back. For the first time all night, he seemed to notice his own fatigue. He pulled off his gloves slowly and dropped them into the waste bin. "I'll update critical care and write the handoff personally," he said. He looked at Claire, then, no longer trying to hide the shift in him. "And I owe you an apology." Janice glanced down, perhaps surprised to hear him say it aloud. Claire finished securing the line and only then looked up. "You were trying to save your patient." "I was trying to save my patient with half the truth and twice the ego." Burke's voice stayed low. "That difference matters." Claire held his gaze for a moment, measuring the sincerity in it. Found no performance there. Just exhaustion and honesty, sharpened by a bad night. "You changed course when it mattered," she said. Burke nodded once, accepting that she was giving him only the portion of absolution his actions had earned. Janice cleared her throat softly. "I owe you one, too." Claire turned. Janice's usual hardness had gone strange in the quiet ICU light. Less like authority, more like armor that suddenly fit badly. "I kept assuming you were in the way." Claire almost said something easy, something that would let Janice retreat without really standing in what she was admitting. But easy was another way institutions protected themselves. So she chose the truth without cruelty. A lot of people did. Janice absorbed it and nodded. "You still caught it before any of us." Claire checked the chart at the bedside. "Then all of us are luckier than we deserve." It was not quite forgiveness. Not quite a rebuke either. It left the responsibility where it belonged. Janice seemed to understand that. "Yeah," she said quietly, "we are." Burke gave final instructions to the ICU nurse and stepped toward the door. "You staying?" He meant with the patient. He also meant in the room in the hospital, perhaps even in the version of herself everyone had only just seen. Claire adjusted the monitor lead once, long enough to make sure he is settled. Burke nodded and left with Janice and the resident, their footsteps fading into the hall where agents now stood watch outside the door. That left Claire Mason, the ICU nurse, moving discreetly at the far counter, and the city beyond the glass. For a while, neither of them spoke. The room was all soft monitor tones and the distant hum of ventilation. Mason lay still beneath the blanket, the edges of pain still visible around his mouth, but no longer ruling him. Claire stood beside the bed with her hands resting lightly against the metal rail, eyes moving from line sight to screen to breathing pattern in the quiet old loop of practiced care. Finally Mason spoke. "You changed your name." Claire glanced at him. "No, Then you were not trying very hard to disappear. I was counting on people not looking. His eyes held hers. That part worked. A faint sound came from her that might have been a laugh in another life. Usually does. He let the silence sit between them again before asking, "How long have you been here?" "At St. Catherine's." He nodded. "A little over a year." And before that, she looked toward the window. The glass reflected both of them, pale shapes against the dark city. Other hospitals. A clinic in Tucson for a while. Some travel contracts. He heard the omissions and let them stand. That, more than anything, told her he remembered who she had been before she became someone hospitals called Claire Bennett R.N. "You left all of it behind," he said. "I left what I could." The answer settled. Mason's gaze drifted to the ceiling, then back. "I looked for you once." Claire's hand stilled against the rail. "When, after Kandahar. A year later, maybe. Thought you might still be in North Carolina near the old training group." "I wasn't." "Number?" He did not ask where she had been. She was grateful for that. Some absences carried too many names. The ICU nurse stepped in quietly to document the latest vitals, then left them alone again with the tact of someone who understood private history when she saw it and knew not to step on it. Mason turned his head slightly toward Claire. "You saved me twice." Claire shook her head. "I interrupted one bad plan and one worse one. Still sounds like saving." She reached up and adjusted the blanket near his shoulder one more time. "Go back to sleep, Commander." His eyes narrowed a fraction. "Still that, too. I am not calling you Mason while you are this annoying." This time the smile actually found him faint but real, then dissolved under fatigue. A knock came at the half-open ICU door. Vaughn stood outside, posture angled to keep the hall in view. "We need 5 minutes with him when he can handle it." Claire looked at Mason. His eyes were already closing. "Not now," she said. Vaughn studied the monitor and nodded once. "Fair." He hesitated, then looked at Claire. For what it's worth, Bennett Sloan pulled the old service record. "You were recommended for a commendation that never got processed." Claire's face did not move. "That sounds like paperwork." Vaughn almost smiled. "You really hate making this easy for people. Only when easy costs too much." He accepted that and stepped back into the hall. Mason's breathing deepened, not fully into sleep, but close enough that his grip on the present loosened. Claire watched the monitor for another full minute. Pressure stable, pulse improved, oxygen acceptable, enough. She moved to the counter and signed the last handoff note Burke had left open, adding only what mattered and nothing more. Her handwriting stayed clean despite the hour. At the door, Sloan appeared quieter than Vaughn, her presence somehow denser. "He'll live," she said. Claire capped the pen. "Looks that way." Sloan glanced toward the bed. "Kesler is in federal custody. His counsel is awake and unhappy. Digital extraction has started. There are enough records to justify broad warrants by morning." Claire nodded once. Sloan remained where she was. "There will be interviews, formal statements, possibly sealed testimony if this chain reaches where I think it does. From me or from him. Both." Claire set the pen down. "I'm a nurse on shift." Sloan's eyes held hers. "You are that. You are also the reason he is alive to testify." The words carried no flattery, only fact. That made them harder to deflect. Claire looked past Sloan into the hall where agents stood at either end. Beyond them, the ICU lights glowed in long, sterile rows, and behind those walls were ordinary crises still unfolding. A post-op bleed, a septic patient, a family waiting beside a ventilator. The world did not pause for conspiracies. "I'll make the statement you need," she said. "Not tonight." Sloan nodded. "That is reasonable." She started to leave, then paused. "Your old commanding physician filed something else besides the commendation." Claire said nothing. "He wrote that under pressure you made rooms larger than they were." Sloan did not stay to explain what she meant by that. She simply walked back into the hall, leaving the sentence behind like a piece of paper on a desk. Claire stood still for a moment. Then she looked at Mason one last time. His face had softened in sleep, not fully peaceful. Men like him rarely manage that in hospital beds, but no longer braced for impact, no longer counting exits through half-closed eyes. She touched the bed rail, once a gesture so small it barely existed, then turned and stepped into the hallway. Vaughn moved aside to let her pass. "You heading home?" Claire looked toward the elevator bank, then back down the hall toward the ER. "My shift is not over." He blinked, perhaps thinking he had misheard. After all this? Claire tucked a loose strand of hair behind one ear. "There are still patients downstairs." For a second, he simply stared at her. Then he gave the smallest shake of his head, not in disbelief exactly, but in reluctant admiration. "Right," he said. "Of course there are." The elevator ride down was quiet. No agents in the car this time. No urgent hands on radios. Just Claire, the soft mechanical hum, and her own reflection in the brushed steel panel looking exactly like what most people would still see if they glanced at her for 1 second and moved on. A tired nurse at the end of a long night. When the doors opened onto the lower floor, the hospital met her with the same familiar blend of fluorescent light, distant voices, and rolling wheels. The federal presence was still there if you knew where to look: a closed corridor, a stationed agent near a stairwell, an administrator speaking too carefully into a phone. But around and through all of it, medicine kept happening. A young father with blood on his sleeve was asking where pediatrics was. An elderly woman was being helped into a wheelchair. A transport aide pushed a cart of fresh linens past a wall of framed donor plaques. Life indifferent and immediate. Claire walked back toward the ER. Trauma 2 was sealed now, dark behind its window. A strip of official tape crossed part of the frame, almost absurd in a room that had looked so ordinary an hour earlier. At the nurse's station, Janice looked up from a chart and then quickly looked back down, perhaps unsure whether to apologize again or simply stay out of the way. Claire spared her the decision by moving past with a small nod. At bed 9, the patient with chest pressure was asleep, at last the monitor above him calmer than before. In the next room, the old man with the sea-rough cough needed his IV adjusted. A call light blinked yellow near the end of the hall. Claire stepped into the room, checked the drip chamber, corrected the rate by a measured turn, and asked the patient if the pain had changed. He looked at her through tired eyes and said, "You the nurse on tonight?" "Yes," Claire said. "Been a rough one." She looked at the line, then at the blanket she tucked more securely around his legs. "Something like that." He nodded, as if that answer was enough for both of them. She charted the change, washed her hands, and stepped back into the corridor. Through the high windows at the end of the unit, the first real hint of morning had begun to thin the darkness over San Diego. Not sunrise yet. Just the earliest dilution of night, enough to turn black glass into a color with depth. Somewhere above her, in an ICU room guarded by federal agents, a wounded commander was still alive. Somewhere else in the building, Thomas Kesler sat under watch with the architecture of his control stripped away piece by piece. And here, under the same lights that had seen all of it, Claire. Bennett reached for the next chart, scanned the medication line, and walked toward the next patient who needed her, as if this, and not the collapse of a criminal operation, were the truest shape of the night. For her, maybe it was. Not because the rest did not matter. Because the next person in pain always arrived before the last story was finished. Claire tied her hair back once more, checked the room number on the chart, and kept moving while the hospital slowly, silently learned how much had changed inside it.